Hey, I'm going to show you a very common type of orthodontic problem that is deceivingly tricky to treat. Uh, it's a case where you have upper space without lower space. So if you see this patient has a fairly large space here between the two front teeth and also over here. And on the bottom, you see very little space, maybe that tiny space there, but on the top, significantly more space. Now, if you notice, this patient has upper teeth that have a slightly forward angle. That means that moving these teeth inward would diminish the spacing. So far, that seems like a win-win. You decrease the forward flaring of the teeth, and you also close the spaces between the teeth, as you see right here. But here's the challenging part. The upper teeth are right up against the lower teeth, or the lower teeth are right up against the back of the upper teeth. That means that if the upper teeth try to move in and the lower teeth don't move in, then the uppers are going to bang against the lower. That is going to lead to a uncomfortable bite. That is going to lead to jaw pain. That may also lead to the back teeth just sort of separating as the teeth get pushed on uppers against the lowers and the patient goes to close and they hit only on the front teeth. So what you have to do in this case is also move the lower teeth in. But again, you have no space to do that, or only that tiny space that you see right there. That's when you need to incorporate something called interproximal reduction. You need to make some very small amount of space between the teeth that does not exist so that the teeth have the ability to move in to the extent that you want. So if you look in this view, you'll see the teeth are moving in. They cannot do that unless they have more space than what's currently present. It sounds counterintuitive because you have a patient who wants spaces closed between their teeth, and you actually have to create some spaces. But the spaces are really invisible because 0.2 millimeters in this case is really small. It's kind of like a hairline. There's plenty of enamel left on the teeth. It doesn't hurt at all. The surface of the teeth is kind of like fingernails. Inside the tooth needs to be numbed up, but not the exterior. So this is an example of interproximal reduction. Now, I have to say, if this patient was not seen in the dental office, if this was an at-home treatment, like by Smile Direct, and there have been many like this will lead to either a bite problem or an unstable result. So interproximal reduction is needed to balance things out in this case.